All right, even more mask mandates are coming for the metro.
And tonight we have an in-depth 360 look at what's being done at the local level, what's not being done at the state level, and what's behind this current COVID surge.
First, where mandates are in place. Beginning tomorrow, Denver, Jefferson, Adams, and Arapahoe counties will all have mandates in place. And that's on top of the 5 counties that already have mandates in place. Those include Boulder and Larimer counties.
And we have team coverage for you tonight to bring you multiple perspectives. And we're going to start with Denver 7's Jason Gridauer and the new mask mandate in Denver announced today.
Indoor businesses in Denver have 2 options: mandate masks or check vaccine cards at the door. Denver Mayor Michael Hancock called it mask or vax.
Wear a mask or get vaccinated.
With the latter allowing places like gyms or restaurants to go maskless if all their patrons are vaccinated. Now, it goes into effect starting tomorrow and runs until January 3rd after the holidays. The main reason is hospital capacity. 95% of Denver's ICU beds are in use with very little room for error and new patients during the holidays. Here's the head of Denver Health.
Our system is on the brink of collapse, and I don't say that to be a fearmonger. We truly are at a point where we cannot continue to do what we are doing without help from the people in the metro region.
The hope from Denver health officials is to slow transmission with masks or vax passports so the hospital system isn't overwhelmed over the holidays. Denver joined with officials from surrounding counties that have also instituted their own versions of mask mandates. The one thing they all have in common is enforcement or lack thereof. Denver, Jefferson, Adams, Arapahoe, and Boulder counties all rely on mainly voluntary compliance and education for businesses that don't, though there are penalties for blatant disregard. In the newsroom, I'm Jason Gridauer, Denver 7.
All right, so let's dig into the data now and give you some perspective on why mandates are going into place in these 4 counties, Denver, Jefferson, Adams, and Arapahoe counties. They are all seeing more than 300 daily cases. Denver is seeing the most with 406 daily cases. Adams County has the highest rate of transmission with 61 cases per 100,000 people.
And statewide, the numbers aren't much better. Another 2,600 new cases reported today. 1,630 people currently hospitalized. But still, Governor Polis would rather support the decisions of counties over making the decisions for himself for the state. Denver 7's Megan Lopez continues our team coverage. And Megan, the governor's firm on this stance.
He is, Shannon. The governor said the people that aren't vaccinated at this point pretty much have made their decisions. While he is pushing for more people to get vaccinated, he says at this point the state is moving into a role of supporting counties with whatever decision they make, and the state is trying to increase hospital capacity by adding 500 more beds.
On the same day, counties around the Denver metro area move back to masks.
So please get that booster vaccination.
Governor Jared Polis spent a good part of his press conference talking about Thanksgiving.
We can celebrate and gather, and we should do it in a way that minimizes risk.
The governor standing firm on his decision not to move back to mask mandates given the availability of vaccines, testing, and monoclonal antibody treatments.
I've made it clear that it's not something that we're considering as a state.
Instead, it comes down to counties like Larimer, where a mask mandate has been in effect for weeks.
Primarily, it was about our hospital situation. Since the end of August, our hospital numbers kept increasing. Since then, we have seen a reduction in hospitalizations.
And they're happy nearby counties like Denver are moving back to masks as well.
We know that having substantially more mask wearing, can really only do good for our numbers.
Meanwhile, in Custer County in southern Colorado,
over the last month, we had a significant increase in our positivity rates.
COVID has seen a serious increase in recent weeks, but in a county of only 5,000, that only translates to less than 50 people. So
there is no plan whatsoever for any masking mandates.
And their numbers have started to dip slightly, even without one.
That's an awful lot of variation.
John Samet from the Colorado School of Public Health says the spread in COVID cases across the state make a one-size-fits-all approach difficult.
On some things, I think we have to say that one-size-fits-all, vaccination. The rate of infection goes down with the proportion vaccinated.
So all these different colors on the map and all these tools we have to fight and prevent COVID are what's keeping the governor from more mandates.
We think it's important to try to work with county health departments and local governments.
As diverse as it is, as a whole, though, Colorado's numbers, particularly our hospitalizations, keep climbing.
For people who are looking to celebrate Thanksgiving with their families and friends, the governor says there are some things you can do, like getting tested before, getting your booster, getting vaccinated, staying home if you're sick, limiting your gatherings, and of course, because we're having such nice weather lately, maybe have those gatherings outside. Dr. Sam, meanwhile, tells me that he's a little bit worried that people might go to celebrating theirs like they were doing pre-pandemic in 2019 with their family and friends and kind of disregard some of those safety precautions. So he's going to be keeping a close eye on the numbers. I'm live. Megan Lopez, Denver 7.
All right, Megan, thank you for that. So let's dig into why we are seeing this surge in COVID right now. It could be a number of things, from the cooler weather to relaxed mask wearing. Reporter Clayton Sandell spoke to local health experts about what they think is behind this surge.
By this point in the COVID pandemic, health officials had hoped the country would be turning a corner.
If you had asked me last June, July, with effective vaccines widely available, if we'd be in this kind of shape in the fall, certainly would not have been my expectation.
Across the U.S., new COVID infections have been relatively flat. Places like Florida, Georgia, and Mississippi are seeing recent drops in new cases. But out west, in states with relatively high vaccination rates, it's a different story. Colorado, California, and now New Mexico, where the vaccination rate is 73%, are all seeing COVID surges. Even in Vermont, where 81% of the population has at least one vaccination dose, cases are up 51%. One Vermont college blames Halloween parties that resulted in dozens of new infections. In Colorado, where 62% of residents are vaccinated, they're not sure what's behind the surge. It could be colder weather, driving people indoors and into closer contact. Fewer people are wearing masks as pandemic fatigue sets in. But those are things that are true in other states, and experts say there seems to be no smoking gun.
Our whole team has worked as hard as we can to see if there's one particular factor that we can point to and say, yes, this is it. We have failed to do so.
And with people about to travel for Thanksgiving and holiday gatherings, experts warn the surges could get worse.
You know, the holidays are a time when we get together, of course, and we share lots of things at those moments, including viruses. And that is a worry.
To help flatten the spikes, health officials are urging people to do two important things.
Vaccinate, vaccinate, vaccinate. The other is people don't need a mask mandate to wear a mask.
Here in Colorado, the current COVID surge means that hospitals like the one behind me here are running out of intensive care beds, which means for people suffering other medical conditions like heart attacks and strokes, urgent care is harder to get. We are also told that 80% of the people in the hospital for COVID infections are unvaccinated. Clayton Sandell, Newsy in Denver.
And we want your perspective now on these latest mask mandates. Do you think they go far enough? Will you comply? Should some other kind of restriction be put in place? Send your thoughts to us at 360@thedenverchannel.com.